The name of my patient is Gabriela Scarlin Sosa Gonzalez. She is 20 years old and she entered to the clinic on the 26th of February. Her reason for consultation was back pain, high fever, and vomiting. Current illness. A 20-year-old female patient referred from the Acacias Hospital who presents a clinical picture of 4 days of evolution, consisting of abdominal pain in the flanks which radiates to her lower back. Intensity 8 out of 10 on the pain scale. Associated with spikes quantified febrile of 39 to 40 Celsius degrees, and emesis. She refers that they performed a urinary tract ultrasound which showed a right urolithiasis. Review by systems. Overall status: the patient is in good general condition, alert, afebrile, oriented in all 3 spheres. In the head, she refers a bad headache for 2 days, 4 out of 10 on the pain scale. Organs of the senses, she does not refer. Throat does not refer. Neck does not refer. Cardiorespiratory does not refer. Gastrointestinal, she reports that she has a lot of colics. Bowel habit is 1 time a day. In genitourinary, she refers dysuria, hematuria, and urinary incontinence. Her urinary frequency is 6 times a day. Endocrine does not refer. Limbs and locomotor refers pain in the joint of her hands, 3 out of 10 on the pain scale. Neuromuscular and neuropsychiatric does not refer. Skin and annexes does not refer. Now, on her personal history, pathological, she refers polycystic ovaries, 3 years ago diagnosed. Hospitalizations does not refer. Surgical, ureterolithotomy performed on February 17 of 2023. Trauma does not refer. Transfusional does not refer. Toxic does not refer. Immunization, in complete adult vaccination schedule, she refers that she doesn't have the COVID-19 vaccine. Allergic cetirizine. Venereal does not refer. Pharmacological does not refer. Genic obstetrics G0, P0, A0. Menarche, 13 years, last period, February 15. She doesn't use planning methods. At the physical exam, we see a female patient that is alert, oriented in the 3 spheres, conscious, afebrile, in good general condition. Vital signs. Blood pressure 122/78, heart rate 120, respiratory rate 20, temperature 37 Celsius degrees, oxygenation 96%. Non-vital signs: size 1.48 centimeters, weight 53 kilograms, BMI 24.2. Skull normocephalic without enlargement, symmetrical, central without scars, no tenderness. Eyes: normochromic conjunctive, normal implanted eyelashes, normal palpebral opening, isocorrect pupils photoreactive to light. There is no pain on palpation. Ears: auriculopavilion normal, symmetrical, normally implanted, intact, without the presence of lesions or scars. There is no pain on pressure or palpation. Nose: central position, no epistaxis, no apparent lesions, no pain on palpation or movement, no masses, normal mucosal moisture. Mouth: normochromic, symmetrical, moist lips, there is no pain on palpation of the gums. Neck: symmetrical, without jugular engorgement at a 45 degrees inclination, without the presence of intractions, pain and movement, no carotid murmur present. Cardiorespiratory: thorax and lungs: symmetrical thorax, without the presence of indrawings, normal thoracic expansibility, vesicular murmur present. Heart: no findings suggestive of pathology, normal heart sounds without the presence of murmurs, reinforcements, or added noises. Gastrointestinal: symmetrical, depressed abdomen is observed, no collateral circulation is observed. She presented pain on superficial and deep palpation in the right and left flank, presence of peristaltic noises, positive right percussion fest. Genitourinary inspection: sternal genitalia not explored, palpation not performed. Skin and annexes: there are no macules, plaques, or nodules. There is no hyperpigmentation, there is no hypopigmentation, normal color skin. There are no messes or areas of pain to the touch. Musculoskeletal system: presents myalgia and arthralgia in extremities. Neurological examination: the patient is conscious, alert, oriented in time, space, and person, coherent language, normal gait, and coordination. Glasgow 15 out of 15, verbal 5 out of 5, IPs 4 out of 4, motor 6 out of 6. Well, now the diagnosis impression is upper complicated urinary tract infection, pyelonephritis, urethral calculus, polycystic ovaries. In differential diagnosis, we have pelvic inflammatory disease. For clinicals, we have an hemogram, urine culture, automatic MIC antibiogram, preliminary one, no bacterial growth was obtained after 24 hours of incubation. MCI urine culture, no bacterial growth was obtained after 48 hours of incubation. Now we have our urotag. The kidneys are in the usual position, which presents a conserved site. In the right kidney, a 3 mm microlithiasis was observed in the lower calyceal group, with slight pilocecal dilatation. Analysis. We have a female patient with a history of polycystic ovary, right urolithiasis and ureterolytotomy. Presents negative urine culture. Physical examination presents pain on palpation in flanks and positive right fist percussion. Kidney stones increase the possibility of suffering from a urinary tract infection, which is why a diagnostic suspicion of complicated upper urinary tract infection is given. She presents signs of systemic inflammatory response, which are tachycardia and fever. This classifies the infection as a complicated one. The urine culture was performed on day 26, but the patient had already started antibiotic treatment on February 24 with cefazolin, which may have altered the results, and a new urine culture is recommended after completing the antibiotic scheme. Other sites of infection must be ruled out, for which a blood culture is requested. Plan. Antibiotic treatment is started with ertapenem 1 gram IV every 24 hours. It is expected to see an improvement in symptoms, that the percussion phase is negative in the following 2 days, and that the infection site can be recognized. Physician orders: normal diet, water consumption, Rangers lactate bolus 500 cc, continue at 60 cc per hour. Ertapenem 1 gram IV every 24 hours. Dipyron and hyoscine 2.5 grams over 20 milligrams IV every 8 hours. Acetaminophen 1 gram VO every 6 hours. Omeprazole 20 grams VO once a day. Requested: blood culture, urine culture, transvaginal ultrasound, and pending contrasted abdominal CT results.